Hello, hello, hello. Hi, how are you doing? Hi, Scott, how are you? Welcome, welcome. Good night to you too. Yes, hardworking nurse. Trying to be. How are you doing? How's your day so far? Okay, nice. Yeah, mine too. It's a little bit cold over here. It's snowing, so I'm stuck. Yeah. What's the weather like where you're at, Scott? How do I pin this? How do I pin this thing? So the number is 469-655 5152. All right, so I'm gonna pin my number just in case anybody wants to call and chit chat with me. Pin. All right, it's up and running. So that's my number if you want to come and chit chat. So Abe, thank you so much, Abe. Thank you for joining on the channel here. Hi, Flo, Oreo, welcome. Glenn Wagner, how are you guys doing? Shivam is asking, hey, Shivam, how are you doing? Your skin is really good and clear. What's your skin routine? Oh, Lord. Skin routine, just a regular bath. Wash with, I use the black soap. You know that black soap, I use it to wash my face and that's it. Then I put on my little moisturizer and, my little makeup, depending on how I'm feeling. Um, Glenn, is that for the live? What? What are you talking about, Glenn? Hi, everyone. Welcome to the channel. Thank you so much for tuning into the live. All right, go ahead and double tap the screen, okay? How are you guys doing and where you're from? Hi, Marvin. Welcome. Thank you so much for tuning in. Um, do you write code? People say my codes are very good. Oh, okay. That's nice, Flo Oreo. No. Light, is it pink? Yes, it is pink. If you're talking about the top. Okay, Glenn. Thank you so much, Grace to me. Welcome. How is the weather in New York? Yeah, so I'm here as usual, charting. Scott says it's 60, but feels like 45 outside in Miami. Okay. Here, I think it is, I think it was 30 something or 20. What was it again? It was 20 something, but it was snowing and then it started raining. Okay. Gonna put you on a little bit of, how do I do this? Add as a moderate. Oh, no. Stupid. Put user in timeout. 24 hours. You can't go. Okay. All right, Grace to me, I'm gonna give you moderator mode just in case you're here. You can help me out here a bit. All right. Scott. Keep that snow by you. Yes, definitely will do. It's like 12 degrees outside in Missouri. Okay. I saw the news with Missouri getting a lot of snowstorm. Yes, Marvin, I was trying to see if I could, do a little bit of add some persons as moderator here. So Grace to me. No, not remove. Add standard moderator. Okay. So how are you doing, Marvin? All right, nice, Grace. Thank you so much. And where is Scott? You're gonna be one as well. Add as a moderator. Standard moderator. Okay. All right. Okay, nice. Yes, I am here, and as usual, I'm using I'm using the time to do my notes and then just try to catch up with you guys as well. Hello, how are you guys doing? Thank you so much, Madeline. Thank you for stopping by. Yeah, so I wanted to kind of just touch on a topic because I have a lot of patients. Hey, Darren, how are you doing? Happy New Year to you. I have a lot of patients here. We're doing a lot of annual exam. So I was gonna touch on that for a bit as well. All right. Okay. Thank you so much for doing that. Yes, I was gonna touch on the annual exam because I have a lot of patients that I saw recently that we're doing annual exams for. So I was just gonna briefly touch on that, and then I know a lot of persons are probably not nurses here, but yeah. I have information regarding, somebody was asking about the DEA. So I was going to talk on that process as well. But if you have anything that you want to talk about, go ahead and, the number is pinned to the live here. So you can go ahead and call me and we can have a talk on the live here. If you have any questions or anything you want to share. Darren, how is your day going? Do you want to call in and chit chat for a little bit? Hi, Carolina Perez. Welcome. I'm doing good, Madeline. How are you doing? Yes, Carolina, I'm getting snow down this side. I think it has stopped and it's raining now, so outside is a little bit yucky. Thank you so much, Madeline, for saying that. Yeah. How is the weather where you're at and where you're from? Okay, thank you so much, Naya from India. Thank you so much for tuning in. Oh, okay, that's fine, Darren. That's fine. That's okay. Yeah. So, as I say, a lot of persons were, or a few persons were asking about some of the things for my my nurse practitioner. I wanted to just talk on the DEA, but I'm gonna talk about, the annual exam first, because a lot of us, it's the new year. Oh, you're in Knoxville, Tennessee. Okay. Well, stay warm, stay warm out there because it's really, really cold. So a lot of persons, we are seeing now and they're doing their annual exams, but some persons are not keeping up with their annual exams each year. So we're just going to talk about that because, that's one way for you to actually get certain testing done, be able to identify certain things from early. So we need to kind of start getting into the habit of, doing our annual exams, both for men and women. I know a lot of the men, them tend to, not wanting to go to the hospital or not wanting to go and see their primary care provider, and that's fine, but at least once a year, try and check in and get some testing done. Because when you talk about your prostate exam or your testing, you definitely need to get information on that and see where you're at, because nobody no want to start be peeing blood and having difficulty peeing later on. So all of those testings are very important. So let's just get into the habit of doing that. Yes, you can go ahead and call the number. If I call that number, what would happen? Oh, you'll just talk with me on the live here, Carolina. All right, that's all. So you can call and share your day with me and, the ThinkNursing crew here. So feel free to dial the number, all right, if you want to. But yeah, so your annual exam is very, very important because, as I said, that's the one time you probably get a chance to do like a ton of tests, especially if you're using your insurance, you will be able to do a lot of testing. So for example, you have family history of certain things, depending on, what's going on with you, then you will definitely be able to get certain testing done just because it's preventative care. Hi, Kadim. Welcome, welcome. Thank you so much for tuning in. John Williams, welcome as well. Carolina, so like I can just talk to you because I'm a kid. Uh, Talk to your mom first before calling, Carolina. All right. I have blood test tomorrow and I'm scared. The Magic Five says that. You don't have to be scared, Magic Five. Just think about something nice. Think about, probably going to the beach or something, spending some time in Jamaica while that blood draw is going on. That's all I can tell you. But it's gonna be hopefully one poke and they'll be able to get a ton of tests during that time. All right. Kadim. Okay, okay. Hi, Blaze over time. What do you need help with? So regarding your annual exam, for my patients in the homes. Oh, yes, people, like up the live. Go ahead and like up the live, double tap on the screen. So for majority of the patients that I see, they're adults. I don't do pediatrics. And so when I go in and see them, most of the time thank you so much, Ima. Most of the time we're doing their annual exam and we do a lot of testing for them. So we go in, you get your blood test done. So in the blood test, we look at your cholesterol level, we look at your kidneys, how they're functioning, your hemoglobin, we look at your A1C to see if you're diabetic or you're near diabetic, and we also look at, your PSA, which is, for persons who are the men. We look at your prostate gland. Yeah, we look at that enzyme there to see what the numbers are. So that way, if you're scared of getting that little finger, nobody wants to do that little test, especially our men. They don't want to do certain testing. So at least, we are able to do, when we're able to do the blood test, we're able to see if there's any problems with your prostate, So before it reaches a stage where, your prostate gland has gotten that large, we'll be able to track your levels in your blood to see what's going on. Hi, John Williams. Yes, Reese Cup, your PSA. Vernon wigs. No, it's not wig, dear. It's all natural. This is what they call 4C. At least this is what I call 4C. All right. Hi, Pretty. Thank you so much for tuning in. All right. So those are some of the testing we do. We also go ahead and do, as I say, we do the renal function as well. We do your renal function as well just to make sure, everything is good with your kidney. And we also go ahead and do referrals for colonoscopy, or if you need your mammogram done, then we'll definitely get those going as well. Okay, Carolina Perry says, I have diabetes. Okay. How is your diabetes going? Are you managing it well? All right. In the house call visits, we do just like your regular. You see, when we come out to see the patients, we do their regular blood pressure. We look at their heart rate. We do physical examination. We also do, sometimes we do glucose check, to see what their numbers are. We also do urine test. And, okay. Yeah, so we do all of those testing. We also do your A1C testing. So for example, you're a diabetic and you're taking your medications at home. We definitely do every 3 months check on your A1C to look at that number to see if you are basically compliant and doing well with your glucose or your diabetes. So we check that every 3 months to make sure you are doing well with that. We also go ahead and get your weights. So some persons we definitely, have to, we don't do weights all the time. Sometimes I'll get, the patient's last weight, just like a verbal, but we'll try to see if we can get an actual weight, every now and again, especially for patients with CHF or heart failure, because you want to know whether or not, they're putting on weight, losing weight, and all. All right. And then during that time, we're also going in. Yes, this vlog is, basically nursing, but anybody that, is interested in nursing and, for regular layman out there who definitely need information, you can ask questions, and this information is for everybody. It's not necessarily only for nurses. So just in case, you're out there, you're diabetic, you're hypertensive, at least you'll have an idea of what to expect when you go into to see your doctor. As I said, this is something that we definitely want to encourage everybody to start doing, getting into the habit of, going to see a doctor, and don't be scared about it. Hi, Bernard. Thank you so much for tuning in. Anthony Coker says Americans know nothing about ackee and saltfish with 6 fried dumplings on the side. Anthony, you must come from Jamaica. Yeah, man, that's something like my ackee and saltfish. Well, not 6 fried dumpling. Some days. Some days definitely do that. Yeah, especially the boiled dumpling. Okay. Kadim says I have diabetes too. Okay. So Magic 5 says I'm getting this blood test because over the past 6 months 6 months there has been blood in my urine twice, and I often have pain going. I'm a male and don't want some guy touching me up. Okay, well, that's fair enough. Go ahead and get your testing done, and hopefully everything is fine with your exam tomorrow. Okay. But yeah, so that's what, when you're going to see your provider, they'll definitely do urine test, they'll do blood test, just to make sure that everything is good. Okay. So T Bankhold says, if I may, why does the medical profession as a whole do not talk about sickle cell anemia, especially how to prevent? It is something that they discuss. Since I've been here in the state, I haven't seen much persons with sickle cell anemia. It's predominantly in my race, let's just say. But I don't really see a lot of persons here with sickle cell. The 1 and 2 that I do see, we go ahead and still treat them. But, we need to just make sure we're keeping these folks well hydrated, taking your medications and all. That's the most important thing, keeping warm and all. So, yeah. But it's not something that a lot of times you hear people talk about. And just trying to make sure that they're not pain-free, but comfortable. All right. Hi, Melton. How are you doing? Thank you so much for tuning in. Son of God. Yes, I'm from Jamaica. Where are you from? So bless, my head hurts so bad I can feel my heartbeat through my head, if that makes sense. Yes. Have you ever had migraines or anything before? Probably you need to just hydrate yourself. You can try Tylenol, Motrin and all. And this is not medical advice I'm giving or anything, but yeah, those are just general things you always start with as a layman. All right. So and then as a part of, when you go in to see the doctor, we will try to make sure we also go through your medications to see what medications you're on. Want to make sure you're not taking any expired medication, because a lot of persons that I see, they're taking medications from 2017 and it's 2025 right now. So I don't know how, they're doing it, but just make sure that medications you're taking are not expired. They're good medications, because that's how you're going to be able to benefit from the actual medication itself. All right. Yes, nobody. Yeah, just keep on seeing your provider regarding that. All right. Just continue seeing your provider and they will manage you appropriately on that. All right, and we also go ahead and make sure you're taking the right medication, the right dosage, because a lot of persons, especially some cultures, if one person's sick, they just assume that everybody has the same diagnosis and, whatever one person is taking, they continue with the same thing. No, it's not supposed to be like that. So not because you have cholesterol problem. Hey, Marvin, how are you doing? Now, because you have cholesterol problem, it doesn't mean that if another person in your household, has cholesterol issues as well, it doesn't mean that, you are going to be taking the same dose. Everything is based on, the evaluation of that patient, assessment, diagnosis. Yeah. So everything is based on each individual's needs. So do not be in the habit of taking other person's medication. All right. And as I say, as a part of the regular exam, you'll definitely get your regular head to toe assessment if you have any issues with your skin, or if you have lung problems, kidney problems, anything that is going on, that we definitely need to find somebody to, evaluate you. So for example, like we definitely need you to see a specialist for your kidneys, then we'll do the referrals for you to see them. And then it's your responsibility to make sure you keep those, appointments and all. All right. Hello, everyone. Welcome, welcome, welcome. Just go ahead and double tap on the screen here. Thank you so much for tuning in. I'm reading your messages. All right. Some of you guys are really, really, a lot of things going on for you guys. So definitely follow up with your providers, okay? Definitely follow up with your providers and explain to them everything else that you're explaining here on the live here with me, okay? But feel free to ask me any other questions regarding certain things. Of course, I massage my hair when I'm washing it. Thank you so much, Nathaniel, for tuning in. All right. And as I said, we talk about the blood count. We also look at your cholesterol. We talk about, your kidneys and your liver function. And another thing is a lot of us, when it comes on to, because you're not, especially if you're in the north, where it's really cold, definitely you want to get your levels checked. So a lot of us, we have like vitamin D deficiencies and all. So definitely we will go ahead and check all of those. All right. And we talk about your prostate exam that you definitely need. So talk with the doctors regarding that, or they can do the blood test. Okay. And as men and women, you still need to go and do your self-examination. So you need to do your testicular exams and you need to do your self-breast examinations. All right. Thank you so much, Potato, for coming in. All right. And then depending on for different screenings as well, for the skin, we definitely look at any moles or anything like that and then do the referrals as well. So a lot of it is going to be, specialists that you'll be seeing to deal with certain things depending on what's going on. Mr. Splinter Kid, thank you so much for tuning in. All right. And then we also can do your EKGs. So for example, you're having your chest pain, you're having little shortness of breath, you're having, you have a family history of certain things going on. We definitely can get your chest x-ray, not your chest x-ray, your EKGs going as well. And sometimes we can encourage you to get a stress test or follow up with your cardiologist, depending on what is happening. So a lot of times, as I say, we definitely have you follow up, but for basic things like blood work, and your medications, we definitely will be able to do those. All right. And then when it comes on to mental health, it is something that a lot of us, struggle with, whether or not you're depressed, you're suicidal, you're having anxiety, we can always go ahead and start you out and start treating. And then, we always try to get a psychiatrist to see you as well. So if you need to be on medication because of something, that's going on, then definitely, we will refer you over to the psych team. All right. So, Shinobi, what do you suggest for not sleeping? more sleep, and then I'll recommend for you to follow up with primary care. Okay. Okay. Thank you, Joan Lowe, for tuning in, and Magic 5. Yes, there is a gap there. All right. How are you doing, Joan Lowe? Anything else? Okay. And then for a lot of persons, the Magic 5, just go ahead and speak. If you're under 18, speak with your relatives regarding that. I don't know why you'd be doing that exam, but anyway, speak with your relatives or whoever is taking it to get that exam done, and then from there you can decide. Okay. If you want to do that, then Elix, feel free to do that. But I don't know why you would be asking that question. Oh my word. Some people just come on this live and just ask anything it seems. But anyways, yeah, so it's very important for us to get our annual exams, as men and women in society. It's very important because that's how you're gonna stay out of hospital. That's how you're gonna stay out of the psych hospital. That's how you're gonna help with improving your overall health. All right, and it's always good to incorporate your diet, your exercise, as well as a part of everything that you're doing. So making sure that you're eating properly, and you are cutting down on your smoking, or you try to quit smoking, your alcohol consumption, you limit that as well, because in the end, the ultimate goal is to make sure that you are, very healthy. um, Pramod, hi, how are you? I'm doing fine. Thank you so much for tuning in. Where are you from, Pramod? All right. And then the other thing is, when it comes on to your annual exam, just try to make sure that